Good morning, everyone. I'm Eileen Doherty, Director of the Colorado Gerontological Society. And this morning we thought we might spend a few minutes talking about the crisis standards of care and where we are in this third wave of the pandemic and how that is just basically affecting everyone, what kinds of problems people are finding. We have probably about 45 minutes worth of presentation here. We've allowed 45 minutes for questions and answers at the end. We don't expect that it will take that long, but if it does, we're certainly here to help sort of answer your questions, help walk you through. In addition to that, feel free to put any questions or information that you might want as we go through this in the chat, and we will do our best to either answer those on the spot or to find resources in the community that we can help you with. So at this point, Maria, if you will advance the next slide. So just a quick overview of how Zoom works. Down at the bottom, if you kind of hover at the bottom, usually, although sometimes it's at the top of your screen, or on the side, there is an unmute button. You can unmute your little microphone if you wish to ask a question. Especially during the discussion section, you can turn your camera on and off with the little camera that says start video. If you wish to ask a question or you wish to have somebody else recognize you, then basically raise your hand through participants. We will do the screen share. If you wish to put something in the chat, there is that little call out that says chat. Please feel free to go ahead and put something in the little red box. If you want everyone on the chat to know about it, then that automatically does it. If you only want to send a message to myself or to Maria, then just scroll through that pull down box and indicate who you want the message to go to. Hopefully most of you have used this platform, but every day we're finding more and more people who are using it for the first time. So we just find it a little bit helpful to provide that information to you as we begin. Next slide, please. So the first thing that we wanted to just remind everyone of is that Colorado does have some crisis standards of care. They are put together with lots and lots of community input. And as part of that community input, the primary committee that ultimately makes recommendations to the governor via the state medical director, which is Dr. Eric France, is called the GERC, which is the governor's basically it's his expert committee on resource allocations. And so that plan was adopted on April the 26th. There are different parts to that plan. There are crisis standards of care for hospitals. There are some for palliative care and hospices. There are some for EMS or emergency medical services. There are some for PPE, and they're starting to work on some for restarting non-emergent elective procedures, including medical, dental, and veterinary services. There are also some under consideration, which I think have been preliminarily adopted for behavioral health, and there's some discussion for some other ones as well. Each one of these areas of crisis standards of care, there are basically triggers, if you will, and if the state has these supply shortages, whether it's in staffing or equipment or whatever, then those are enacted. And as you can see, the PPE ones, which although there is more PPE in the state at this point in time, it is still something that we are experiencing a certain amount of shortage of, and probably will have additional shortages as we go through the next few months. Similarly, the EMS has been activated. Again, that is to protect our EMS resources for the most critical needs, rather than to be using those haphazardly. The palliative care and hospice services, those have been put into place, but they have not been activated at this point in time, although there is a fair amount of discussion, especially with the various hospices that have been involved with this, as well as some folks from the University of Colorado, in terms of what that looks like, when to initiate them, and how that might be activated. We are also probably looking at a lot of the standards associated with hospitals, especially in light of the staffing shortages that are currently occurring. Next slide, please. So let's talk just a little bit about the coronavirus surge and what Colorado is doing. So at this point in time, we have several different slides here that are specifically focused on the surge. So the executive orders, basically, we are expecting that there will be a surge bed count in the next couple of days. Hospitals will then be required to increase their capacity as high as they can to augment both COVID-19 patients as well as non-COVID-19 patients. And we've already begun to see some of that. Some of the local hospitals have been converting, say, for example, some of their surgical units back to ICU units. Some of the hospitals also have begun to limit the number of COVID-19 patients that they are able to treat. Other things that happen is that some places, because we've now entered the red zone, are starting to look at what elective surgeries that they can implement. And there are now in place systems that are being operationalized to do transfers between hospitals or to transfer equipment, depending on what makes the most sense. So if there's capacity at one hospital, but not necessarily at another hospital, then individuals might be transferred from one to the other. One of the biggest concerns or warnings at this point in time is that if the number of patients continues to grow, then the state might be required to open up the alternative sites. When we first started back in May or so, we had 6 alternative sites, and some of those were shut down. So what we still have left is one at the Colorado Convention Center with a limited number of capacity beds. We have one in Westminster at St. Anthony's, and we have one down in Pueblo. The state is also looking at how to staff those. Those are definitely seen as step-down units. They are not seen as extended like field hospitals, but they are step-down units from the hospital. There's been a lot of confusion that I have heard over time about using these alternative care sites for discharges from nursing homes or discharges from assisted living or transfers from individuals who live in their own homes. specifically to these step down or alternative sites. These alternative sites are only available to hospitals who are over, who have too many patients and are unable to care for them, and they would be discharging those patients to a little lower level of care. The State Emergency Operations Center, that has changed to a level 1, meaning that the state is basically readying a number of different state agencies that are going back to working together to start addressing the various needs that the state is experiencing, especially with the current fears that we will go from a red to a purple. And I'll talk about that in a little bit. Next slide. So the local public health directors have basically submitted a letter to the governor on November 5th. Basically, their goal was to get the governor to increase or enact tougher measures, specifically for the purpose of trying to contain the COVID-19. And as of tomorrow, November the 20th, a number of counties that have been on orange, and some that went in a very short period of time from yellow to orange to red. Many more counties will be going to that level, and that means that there will be more stricter guidelines in terms of what we all can do, again with the intent to stop the spread. The state is also developing its own framework through this color-coded process and putting various counties in red or stay at home as is determined necessary. Local public health authorities will still have the authority to basically enact state stay-at-home orders or whatever. So there is still the ability to have local variants, and each of the counties does have to declare their own emergencies at this time. Contact tracing, there is a new app that went live on October the 25th. You can download it into the settings in your either smartphone or iPhone. And what happens is that if an individual with whom you have been in contact with tests positive for the virus in the past 14 days, you get a notification on your phone that you may want to get tested as well. The goal is to get about 15% of the state population to use the app, and that is then identified as another source of helping to control spread. Approximately 100,000 people have signed up as of earlier this week to use that app. If you are having any difficulties or you don't know where to find it, first I would suggest go to your settings and see if you just have to activate it, or if you need assistance, feel free to call our office and we'll be happy to walk you through it. Next slide, please. Another thing that the state is doing is Governor Polis is planning to call a special session. His idea or thinking at this point in time is to try to figure out what kind of COVID relief funding might be available. For example, I looked at a preliminary agenda, and one of those might be to require small businesses to be able to retain the local sales tax that they are collecting, rather than to have to forward that to the state. In addition to that, they're looking at 5 or 6 other measures. One of them is to try to figure out how to fund broadband for schools. I am planning to make a request to see if that could also be expanded to some of the homes of our older adults. And I've put a request in this morning to one of the governor's staff to see if I can at least have a preliminary conversation about that. The legislature is scheduled to go back into session January the 13th. One of the lobbyists that I heard talk this week implied that the legislature is also looking at what that might look like. You may recall that the legislature is in session for 120 days. Last year, they met up until mid-March and then came back later in late May and June to finish the state's business when the pandemic spread had been reduced. There is some speculation that that may occur again this year. Simply because the expectation is that we may have a vaccine that might be available later in the year and help with the spread. There's no formal guidance at this point in time. It's purely speculation. Another thing that the state has done is that they have changed the COVID dial. So when it was initially released, it had 5 levels. And as of either late last week or early this week, they added a level purple, which they are now calling extreme risk. And we'll look at that in a few minutes. I personally believe, and I think there's some consensus out there to support this, that the reason we went to a level purple was, even though it requires some reduced activity within certain groups, it was an attempt to keep some of our small businesses open, even at a minimal level, so that we didn't shut the entire economy down. Next slide, please. So the other 2 areas where we have done some additional work in terms of the surge is that the Colorado Department of Public Health has released a guide for Thanksgiving with some do's and don'ts, as well as travel and shopping instructions, and we'll look at that in a few minutes. Basically, the health department has provided guidance to the legislature to convene as safely as possible. Again, possibly looking at such things as what can be done remotely. The lobbyist that I listened to her presentation yesterday suggested that lobbyists as well as citizens basically are being pretty much banned from entering the Capitol, again, to reduce spread and to be able to reduce the need for cleaning and support staff and exposure. And then the Colorado Chief Medical Officer, who is Dr. Eric France, he has issued guidance that Coloradans should remain extremely diligent until we get a vaccine. The important thing here to understand is that even when a vaccine becomes available, there will be certain limitations on how that is distributed, who will have access to it, and we'll look a little bit at that in a few minutes as well. So Dr. France is pleading with all of us. There will be another meeting later today with his group on long-term care, which I will plan to attend. But basically, he is urging everyone to do the things that we all have hopefully become very familiar with, which is to wear masks, practice social distancing, socialize only with the people who live within our own household, and if we can be outside for any reason or other, to take as much opportunity to do that if we are meeting with other families or other staff or colleagues. Next slide, please. So this is the new COVID-19 dial frame. So green is where you basically go pretty much back to normal. And then blue was where green and blue, where a lot of the state was for a number of months after the first initial surge in the spring. Yellow was concerning, but we were still able to kind of move around a bit. Businesses were starting to open. And about 2 weeks ago, we started to see a significant number of the counties moving from yellow to orange. And there is a dial at the state health department's website that as you move that dial and look at the projections, a good portion of the state is expected to go to red or severe risk. And then with the new guidelines in terms of severe risk, they added the purple level. So what red basically means is that there is again a link with the various kinds of restrictions that are required depending on what is happening. So I just want to briefly review the link on the red, which a number of counties will be going to tomorrow. So basically, if you are a high risk population, which obviously older adults are, basically, if you are in the workforce, you should be working primarily from home, and it's mandatory prioritization if you want to work from home. There are very few variances that the health department will grant. If you are in the red zone, you're pretty much on lockdown or stay at home. When we go to that tomorrow, personal gatherings are basically not allowed. Childcare will remain open, but again, with certain social distancing practices. Schools in preschool to 5 can be either remote or they can be a hybrid with similar things for middle schools. Hybrid is suggested for high schools for sure, and a lot of middle schools are adopting that as well. Higher education is remote. Places of worship basically go down to pretty much 10 persons or 25% capacity. If they're indoor, you can go up to 50% or 25% or 50% if you have a large enough facility. Smaller facilities basically are closed. Restaurants will go to takeout only or delivery. Outdoor restaurants can stay open. But again, they do that at their own risk, and patrons are encouraged not to do that. Last call, basically in bars, goes to 8 p.m. If it's on the premises, offices are being asked to go to 10% or to work remotely. Bars are closed. Gyms and fitnesses basically are at 10%. Or some of them are even being, again, encouraged to close. Groups such as ball games, concerts, all of those kinds of things are pretty much all closed out. A few of them are open at 10% capacity. But pretty much where we are at this point in time is that a large portion of the state will be on red in terms of the population centers for the period of the next few weeks. As you can see, then this is just a summary of those different levels in red. And the reason I went through that is because many of us are going to have to try to run our businesses, our housing facilities, our assisted living programs. All of that will be basically under the guidance of the red. Hopefully within the next few weeks, with the precautions of everybody being on red, the governor will not have to declare a level purple, but basically if he goes to level purple, our biggest problem will be that our hospital capacity system is overrun and we do not have the ability to take care of people if they get sick. Next slide, please. So these are the counties that are going to red, orange, and yellow over the next day or so, basically tomorrow. If you look at this list, Adams, Arapahoe, Boulder, Denver, Douglas, and I thought Pueblo and El Paso were on a list that I looked at this morning. So at this point in time, it's a lot of Front Range stuff. And then some of the outlying communities, Castillo, Custer, Montezuma, Pitkin, Western Slope counties are going on orange, as well as a couple of counties in the San Luis Valley who are moving up to yellow. So the disease is spreading statewide and it's moving pretty rapidly. Next slide. This is a slide that looks at the epidemic curve, and what we can see is basically that this is the cases in the past 2 weeks from November the 2nd to the 16th. And as you can see, a lot of the kind of bright pink was low, but we didn't have much of that. The darker pink is elevated and the purple is very elevated incidence. So nobody is on a decline at this point in time. And maybe that's where I was confusing, because El Paso does end up on this list, as does Mesa County on the Western Slope. Some of you may know that Mesa has been able to be relatively open for most of the pandemic and has really led the way in terms of, if you will, getting back to normal and opening businesses. But now they have a significantly higher elevated rate. Not 100% sure why some of the planes have been increasing, but we have seen that across other country or other states as well. We know that they have maybe not been as vigilant with some of the COVID-19 practices, but we are seeing a very high incidence rate. Next slide, please. Overall, this is the county ratings, if you will. And this was earlier this week in terms of, if you go to this link on 11/13, the state looked like this, which is, we don't look too bad. We got quite a bit of blue. We got even a little bit of green. Yellow was some caution, and quite a bit of orange, which is, kind of safer at home, but we don't have any red. Next slide, please. But now, if we look at this on November 18th, which is yesterday, you can see how quickly this has spread. And what we have at this point in time is only 4 counties that are green. We have about 7 counties that are orange, and the rest of the state is all entirely red. So our incidence rate is climbing by leaps and bounds, even in the states that were blue and yellow a few days ago, a week ago, or even some of them green. We see a significant increase. So this is what is frightening from the perspective of, will the governor and the state medical director have to declare a state of emergency? Next slide. So this is the COVID cases that are reported. And as you can see, our rates continue to climb every day. This graph is really very misleading because in the early part of the pandemic, and it hasn't even been till really this fall, that we have been able to get quite a few testing kits. So what we see really is if we looked at this for the last 30 days in terms of testing, maybe you could include the last 60 days, but if you look at the testing data, if you will, in terms of cases, what we see is lower rates earlier, and we didn't necessarily have the capacity to test. We didn't have everybody going to the hospital. So we do see that our cases are increasing, but our systems for reporting are much more sophisticated at this point in time. The other thing that I will mention is that this morning I looked at the data that gets updated every Wednesday afternoon by the health department, and we are seeing significant spikes of cases in assisted livings and nursing homes again. And this does not bode well for many of the residents in those buildings. Next slide. So the next slide is the death rates, again, for COVID in 2019. As you can see, as all of us were very, very worried and concerned, and many of us lost loved ones in early March and April, we were all losing relatives and friends at a very high rate. That tapered off through the summer. And some days we were as low as only 2 or 3 individuals passing away. However, what we see now last week is, again, we are up above 20 people, 20 or more people a day. Now, for the last couple of days, those death rates have decreased again. In this particular data, it's not specifically shown, but in the data that we have looked at where it's age segregated, we see that a very high number of individuals are older. Next slide, please. What we can see here is how many people, again, are hospitalized, and this is another measure that is being currently used to determine whether or not we declare a crisis standard of care for hospitals. As you can see, this graph, the blue, shows us how many people are hospitalized. And as you can see at this point in time, we are right at or a little bit above 1,200. This is for all of the individual or all of the hospitalizations across the state. You can also see that there's still a few that we haven't been able to confirm, but we have a very high rate. Now, what is happening within our hospital systems, and many of you may have been hearing this on the media, is that our hospitals are experiencing significant staffing shortages. So even though we may not have problems associated with bed capacity, what we have is several other things. One is we have healthcare worker fatigue, meaning many healthcare workers are extremely tired. They are asking for time off. They are calling in sick. They are just trying to protect themselves. A second thing that is going on in terms of hospital workers is that they are short-staffed, and that is happening for a couple of reasons. Many hospital workers are being quarantined because of their exposure. And as you might guess, if you are in a hospital and you are a nurse or you are a respiratory therapist or you are part of the cleaning staff and you are being asked or required to clean on a regular basis or to treat COVID-19 patients, that increases your exposure dramatically. Also, because we have limited PPE, we're not always practicing what the hospital industry had identified as the gold standard for infection control. So we are seeing things like some hospitals using masks more frequently than they might want to or might have a year ago or 2 years ago. Similarly, they're looking at all kinds of ways to conserve PPE to be able to treat as many people as possible. So next slide, please. So the death rate among COVID-19 individuals by age range, as you could notice in some of these slides, our incidence rate is very much higher among our middle-aged individuals. However, our death rates, if you will, are much higher among older adults. So what you see at this point in time is if you look from the 60 plus over to 81% of the individuals who have died as a result of COVID, and maybe that number is actually a little bit higher. 76 and 12 gets us up to 88% of the individuals who have died from COVID are age 60 and over. This is one of the reasons why we want you to be extremely cautious as you work in the field of aging. You are a high risk for your residents or the clients or patients that you serve. And so when you are being asked to, as individuals, to keep people in their own homes or in their own rooms, people to stay safe at home, for people to not go out for Thanksgiving, when you look at these death rates, they are very, very frightening among the older adults. Next slide, please. So when we look at the percent of cases by age group, this is what I referred to a little bit earlier. If you look at the pink boxes, what you basically see is that there's a pretty high case rate. There's 40-some% are between people between 20 and 39. The darker purple then is about 37%. From 40 to 59. So if you add those together, clearly 77% of our cases are in the 20 to 60-year-olds, and with fewer cases being contracted by people 60 and over. However, as we saw in the previous slide, what you basically saw was that the death rate among those was significantly higher. Next slide, please. So let's switch our attention, if you will, a little bit to maybe something a little bit more positive. And let's look at the efforts related to vaccines. So next slide. So we have several companies that are getting ready to submit their vaccines to the Food and Drug Administration for what is frequently called, or what is called, an EUA, which means an emergency use authorization. What this means is that the Food and Drug Administration is being asked by the companies, due to the urgency of the situation, that not all of the testing and safety measures that might be required for a vaccine under normal circumstances, that some of those be basically shortened, if you will, and that part of the protocols that the pharmaceutical companies are required to do are still very high in terms of their safety measures, but they may not have as much data as they may like to have associated with things like efficacy beyond 30 or 60 days. They may not have as much information as they would like in terms of long-term results of the vaccination. So for example, if you get a polio vaccine, that's pretty much, you don't have to get another one for life. Whereas a flu vaccine, you have to get those annually, and they have higher dosages for older adults. So and that basically comes with further testing and further work on the part of the pharmaceutical companies. So some of that, in the interest of trying to get a vaccine out, that is coming under the rules of the emergency use authorization. So what we've been seeing in the media, there are two companies, Pfizer and BioNTech, as well as Moderna, who are very close to requesting an EUA from the Federal Drug Administration. Probably will be submitting that very, very soon. Both of them, in the trials that they have been doing, which have looked at combined around 75,000 people, in those trials, they are basically looking at about a 95% effective rate. Again, this is at the current rate. We don't know, it might be higher a year from now, and it might be not quite that high if they were doing additional testing, which they will continue to do. There are two very big differences in terms of the two vaccines. The Pfizer vaccine is going to require that the vaccine itself be stored at 94 degrees below 0 Fahrenheit. This is colder than the North Pole. Moderna, on the other hand, has basically that you could store it at 25 degrees Fahrenheit. This is basically in a freezer. So one of the things that is of concern at this point in time in terms of the Pfizer vaccine is that it probably will be more available in urban areas than in rural areas, just because of the ability and to get it distributed. Those distribution decisions are being made by the CDC. So each state is being given a certain allocation. At this point in time, it looks like Colorado might be in the distribution formula for some of the vaccines from both companies. One of the things that is extremely important is, and you as a healthcare worker or a individual who gets a vaccine, is that if you get a Pfizer vaccine to start with, the second dose will need to be a Pfizer vaccine as well. So again, just making sure that you go back to the same provider so that they can check the record and make sure that they give you the right vaccine. A lot of the companies that produce vaccines are gearing up to do mass production. And those, again, are in various stages of approval. This morning, Public Radio has another company that is looking at producing vials and syringes, but that has not been approved yet by the FDA. So even once these drugs or these vaccines are submitted to the FDA and approved, we still will have a lot of issues associated with distribution, storage, and then the other thing that they're really working on is what is the transportation. So how do we get the right refrigeration storage trucks to leave wherever the storage facilities are, get those to the local places where they will then be distributed. It looks like they'll be distributed to various points of service locations rather than through a central storage area, but that again is not yet identified or finalized. The other thing that Colorado did in early October is that we were required to submit a draft plan in terms of how we would distribute it and who would be getting priority. So if we could have the next slide, this is pretty small. So there is a link on the right-hand side, and if you want to read this more carefully, you can do that. I will call out that the highest level of priority are the people who are in red. And the red is divided then into 4 subcategories. The very first category is inpatient hospital workers or healthcare workers, including assisted living and nursing homes. We were able to really advocate that because of the very high risk of older adults, that those healthcare workers should be given as much priority as the inpatient hospital. The second group then are outpatient healthcare workers, and this is individuals such as home care workers, hospice workers, individuals like that. The third level then is our critical workforce, and this is people like ambulance, fire, public health workers, correctional facility workers. And then the third group is, and those two groups really are prioritizing, if you will, the workforce, the labor force. I think what we've learned up to now is that if we can keep the labor force healthy, and our critical healthcare workers, if we can keep them healthy, then what happens is that we have less spread both to the patients or the individuals that we're caring for, as well as to our families. So that is how they have prioritized that. The state also took a look at the third level, which is the high-risk populations. And these are individuals who actually reside in nursing homes and assisted living. So those people have been given a very high priority. The state has also been extremely proactive in that they have asked for a plan then in terms of assisted living and nursing homes to participate in dissemination. So what they're able to do in terms of getting their residents access to the vaccines is also a proactive stance that the health department has taken. Moving down into the yellow level, we see that congregate facilities or housing and essential workers are the two groups of people here that have been prioritized. So this is basically people who are homeless, who are living in shelters, people in jails. But again, we've been able to ask them to prioritize individuals who live in congregate facilities. So this is like our low-income senior housing, our independent living facilities, our retirement communities. So they are being given, again, a higher priority than the general community, again, because they live in very close proximity. Other groups are college dorms, and they did move workers in congregate facilities to this kind of high category as well. Essential workers, these are the people who make the world go round. These are the people who continue to work almost every day. There are grocery store workers, our retail workers, people who work in agriculture, teachers, childcare. So that again is, those people have been identified as essential workers. And then the next category is people 65 and over, or people who have various kinds of comorbidities. And there was quite a bit of thought and time given to those comorbidities that would be given a higher priority. And the reason for that basically being that we also know that this is the group of people who have succumbed to death. So while we might want to have everyone 65 and over vaccinated, my own personal opinion is that it makes a lot of sense to deal with our essential workers prior to older adults, because even older adults with comorbidities who are living in their own homes or their own apartments do still have the ability to practice safe at home practices, because our community has spent a lot of time and energy coming together to support a lot of those individuals. And I believe that if there is additional supports that are needed, would you please let us know here at the Society? We are working every day with trying to help to deploy various kinds of resources and services, and partnering with a large number of agencies to do that. And then lastly, our third group is basically adults 18 to 65 who do not have any high risk situations or conditions. So hopefully this will help you to figure out where you are in terms of the high risk category. I've heard varying numbers that our first dosages that Colorado may need might be only 50,000. We did hear recently that it might be a much higher number. So again, it's we don't know what our allocation will be, and we don't know whether there will be any manufacturing hurdles that the manufacturers will need to overcome, or the transportation kinds of things. So we need to be vigilant there. The second thing is that even if we get 300,000 doses, say for example, that will only cover 150,000 people, because we have to make sure that we save the second dose, or enough second doses for everybody who needs it to reach the levels of efficacy that we need to reach. Next slide, please. So healthcare workers, this is just a list of who the state has identified. And as you can see, there's a wide variety of groups. It's not just docs and nurses, but it's also therapists, pharmacists, lab people, radiology, social workers, case management, and they have actually also added here mortuary services. And the reason for that being because of the high death rates. And so we need to get those people protected as much as possible as well. Next slide. And then this just gives you a little bit more definition of who are essential workers. So healthcare operations, these are the manufacturing and the distribution folks. And they've put food banks in here twice. So food banks are both under healthcare operations. They're also in the box that says providers of basic necessities to economically disadvantaged people. So they are identified as essential workers as well. And the other group in that providers of basic necessities are people who are running homeless shelters, as well as human service groups who are either providing direct care or voluntary programs. And basically that is where we at the Gerontological Society have placed ourselves. So we are hoping that we will continue to be able to operate as an essential worker just because of the large number of services that we are currently brokering, as well as delivering in the way of food and a variety of other services. Other critical essential workers are manufacturing. This is food, medical equipment, retail stores such as grocery stores, Home Depot and those kinds of groups, gas stations. Critical services, these are people like teachers and childcare workers, maintenance people, and then critical workers to maintain safe sanitation and health. This is disinfection services, and then some government services. However, I should point out that most government services are working remotely. Next slide. So the definition of high-risk conditions for severe COVID-19 and disease, these are somewhat in flux. But they have come up with kind of a list of conditions. And if you look at this carefully and you compare it to the other list, this is basically just the listing of who's at highest risk. And this has been in the media a lot recently. So people who are obese, people who have diabetes, people who have COPD, those are very high risk comorbidities, as well as just by virtue of the fact that you're over age 65. Next slide. So the holidays, nursing home and congregate facility guidance has been issued, as well as Thanksgiving guidelines. Next slide. So in April, when we were at the stay-at-home order, if you look at this graph, our outbreak trend was way down, below probably, I don't know, maybe 300 per the 100,000. As you can see, if you watch this graph here in November, our outbreak trend is much higher. So this is why we see the state basically going to a red category. This, again, you can track this at the health department's website, and it changes every day, but we are not trending in any way, shape, or form at this point in time down. What the health department and the governor are hoping is that very high tip in terms of the blue dip in November of 2020 will start to level off. Even if it does not go down, that we will see it look more like the June and July and August numbers rather than like it's currently looking. Next slide. Hospitalizations, as you can see, again, when we were at the height of this in April, we had somewhere around 900 people in the hospital. As I indicated a few minutes ago, we are up over 1,250 at this point in time. And even when we had the major surge in July, we never got above about 300 COVID-19 cases. So you can see that again, as we have more people and as we're trending upward, we're also getting more hospitalizations. Next slide. So things that go into making this decision is that if we have been practicing and people have been encouraged to get together in groups outside. As a matter of fact, at one point, the governor led a whole big campaign on the great outdoors. And the idea was to encourage people to get out and to come together in outside settings. What we find now is that if you are in an inside setting, you are 19 times more likely to contract COVID-19 than if you are outside. As we all know, as the weather gets colder, we're going to be all less and less willing to be outside. Although there is some correlations and some looking at relationships, if you will, between flu and COVID-19, our biggest concern with flu at this point in time is that people who contract the flu might also be required to go to hospitals. So again, we're trying to look at keeping flu down as minimally as possible and encouraging as many people as possible to be vaccinated for the flu. The other thing that we've talked a little bit about so far is medical shortages in hospitals, and this is becoming very, very real at this point in time. Next slide. So nursing homes and congregate facilities, the current guidance basically is that there is restrictions on non-essential individuals. There has been a national effort to look at ways to have family members more engaged, if you will, in being able to come into the nursing home. There has also been some relaxation in terms of who can enter into nursing homes. So we've, as time gone on, more therapists, doctors, et cetera, are being able to go into assisted livings and nursing homes. There's also a new category that's being looked at to have a family member be identified as an essential caregiver, so that at least maybe one family member might be able to start visiting in assisted living and nursing homes. But my concern at this point in time is that that's not going to be very feasible, given the fact that our numbers are trending up. Facilities were required to submit isolation plans, and those are being updated and having to be updated on a regular basis. There's a deadline for some of that that's due later this week. The other thing that I want to mention here is that if any of you are in nursing homes, assisted livings, hospitals, I want you all to go to something called EM Resource. Although it's not mandated from a point of fines, that is how the state is keeping track of staffing needs. It's how they're keeping track of PPE needs, as well as other shortages. And so you're asked to set up your profile if you haven't done that already, and to go in there every single day and update it. And what the health department has been pretty clear about is that they will be making decisions based on shortages of supplies and staff on what is in EM Resources. So if your information is not current and you have an outbreak and you needed, a big load of PPE, you may or may not be able to access that and have that come to your house through the state distribution systems. You can obviously still order it through the retail marketers, however you might secure it, but you might find that you are having problems. Another thing that is being required in the nursing home and congregate facilities is disinfecting. So hand sanitizing stations are also required or suggested, highly suggested. Employees are basically complete a health screening, do frequent hand washing, do various kinds of documentation, keeping track of all of those, and trying to make sure that if you do have essential visitors, that only 2 of those are seeing a resident again at any one point in time. So trying to limit that exposure. Next slide. So here are the Thanksgiving recommendations. So only interacting in person with people in your own household. There is suggestions that keeping that to 6 or under, do not travel. If you do have multiple households coming together, to wear a mask, especially when you go out grocery shopping. Other things that you might want to just consider are things that probably many of us are already engaging in, which is video chatting, sharing recipes, sharing with neighbors, but practicing social distancing, etc. I, for example, have an older gentleman who's been coming to our house for probably 30 years for Thanksgiving, and probably around 4 or 5 o'clock in the afternoon, I will pack him up a Thanksgiving dinner that he can then put into his microwave. It won't be the same as sitting at our table, but at least he will have the benefit of home-cooked turkey and pumpkin pies and all those kinds of goodies. Next slide. This is just a reiteration of that. The other thing is that if you are traveling, hopefully you have started to quarantine. If you're planning to interact with another household, and if you are coming together, then plan to self-quarantine for 14 days afterwards. Next slide. Black Friday, again, consider doing a lot of this online, doing home delivery or curbside pickup. Big shout out from the governor's office to Shop Colorado businesses if you can. Thank you. Or next slide. So they're not recommending any kind of travel and the usual safety precautions. There are testing sites. If you believe that you have been infected, why click on the link for the testing site to see if there's one near you. And they are also ramping up some of that. Next slide. So I just want to spend a couple minutes on moral distress. And this is basically something we talked about this and used some of these same slides earlier in the year, but I think we are all very worn out and very burned out at this point in time. So the moral distress and moral injury are basically emotions. They are bodily changes, physical changes that you experience that basically accompany a disconnect between what you believe is right and good and what you're able to do and what you see happening around you. And I know that I personally, every day, when I hear about death rates and how to keep people safe in nursing homes, and I argue it from the risk side in terms of nursing homes and assisted living, it's like I can't let more people in. But when I try to say, but how should they interact with their families? I know that that's critically important. And I can't seem to ever come to a really good answer to let all of us visit our loved ones in nursing homes and still protect all the residents. So just a little bit about moral distress. It's basically, it's an emotional response. It's, I feel bad because I couldn't do something. I'm angry, I'm feeling shame, I'm feeling self-doubt. I wish I was doing this differently, but you know, that's just what happens. In terms of moral injury, basically now I am starting to see physical things. So I'm waking up at night, I can't eat. And then the other one is moral distress and injury. And basically we have social impacts that go with that as well. So we're just really not feeling very centered. Next slide. So moral suffering is the anguish experienced in response to moral harms, wrongs, or failures, and the unrelived moral stress. So this could be triggered by witnessing things that are not happening. Had an example of that this morning where a lady who runs an assisted living facility, and she was unable to get the care that her residents needed. And she was extremely suffering because all of her residents and her staff became infected, and she really was not in a position where she could do anything. The graph on the right looks basically at the different characteristics of distress, psychiatric disorders, behavior, and resilience, and spend a little bit of time reading that as well. Next slide. So the definition, according to Cindy Rushton, of moral resistance is basically our capacity as individuals to sustain or restore integrity in response to this moral adversity. So somehow we have to be able to get through it. We have to understand that we may not be able to justify our actions, but we have to be able to get through it, and that is resilience. Next slide. So these next couple slides basically help you to identify what you are feeling. So are you feeling moral distress? Are you feeling all this different conflict and dilemma? Are you experiencing burnout with mental, physical, and emotional exhaustion? Are you feeling compassion fatigue? Because basically the people that you're caring for, you're not able to take care of them in the way that you would want, or many of them have suffered and had to go to a nursing home, they've had to go to the hospital, or they have passed away. Next slide. The second thing then is to assess your level of moral distress, and you can use this thermometer on the right, And if you use the little icons along with the symptoms, that can help you to also figure out what you're feeling. Hopefully most of you are not at a 10, but if you are, I highly recommend that we put some systems into place to help you through this very difficult time. Next slide. If you can, on level 3 is to look at what are the causes and constraints. Is this something that you're putting on yourself or you're being asked to do? Is it where you work because they don't have the right amount of staff, or you're feeling like a lot of this burden is falling onto you? Or are they organizational problems, which is they can't get staff, they don't have enough money? Hopefully, although I would believe it, that there are no businesses out there that are really putting undue burden on you in the interest of making a profit. Hopefully we're all in this for the right reasons, but I cannot always be sure. Next slide. So these are some resources that you can do personally. These are some things that you can do for yourself in terms of taking some time out, finding people to talk to, getting involved in self-care kinds of things. Another is, what can you do for other people? So what can your unit do? Can you provide opportunities for people to take a break? Can somebody be available to talk? Can you use the thermometers? And then what can the organization do in terms of providing resources and support? Next slide. So this is just a little worksheet that you can use for yourself to fill this out, and hopefully you can then share that with yourself, share that with your department or your unit, as well as with your organization. Next slide. So this model comes from the American Association of Critical Care Nurses, and they have the 4 A's, which is what we've been going through: ask, affirm, assess, and act. And basically, this is just finding, again, a safe place for you to be, listening to each other, taking care of each other, being a support to each other. Next slide. This just validates how to go about the 4 A's in terms of what are the signs and symptoms. Be open to asking and helping your colleagues. Affirm it and validate it. Make sure that there's good communication lines. Give people time off. And then act or assess. So, is the person at risk? Figure out what their experience is feeling like, what the obstacles are, and then try in the act stage to help people work through this. Next slide. So I want to do a shout out for a new moral distress website. And we got clearance late last night to be able to give you access to this. A lot of the information that's here that we presented is available, but there is a much more comprehensive amount of information on that website. It was developed by a group of colleagues led by Dr. Barbara Stratland at Denver Health Medical. And we will give you the link for that when we send out the slides this afternoon. And if anybody is wanting additional resources or training sessions in that, I have reached out to a couple of people on that group about offering some a series maybe on whole moral distress, especially for healthcare workers who are feeling just very not very empowered. And if people are wanting that, please let us know either through the chat or just send us an email at cogs@senioranswers.org, and we will see if we can get some of our experts in the area of moral distress to help with that. So at this point in time, I will open it up for any kind of questions, and Maria is seeing those, so she will help to facilitate that.
Eileen, we have gone 15 minutes over time, so in order to respect people's time, we will address all of those questions in the follow-up email, and that email will include a copy of the PowerPoint in addition to the link to the website that Eileen gave the shout out to. So,
Oh, I'm sorry. I guess I thought I had till 12 o'clock, so I was not racing. I am sorry that I got all confused, guys. So thank you for your patience.
yes, thank you everyone, and we will send that information your way. Have a wonderful day.